Thanks, Travis. We're going to move pretty quickly here because I think we want to get into the exercise piece. This really is, I think, what we would call the end of our Healthcare Coalition meeting. And this is where we break and we transition into our what we were calling our CMF workshop. But we're going to make that a smooth transition. So if you need to, if you need to leave or don't want to participate in that work group activity, feel free to leave if you have to go. But you might want to stay and hear what Casey has to say about the upcoming exercises. The one piece that I would add to our Healthcare Coalition agenda is, as Travis said, we're continually looking for feedback. We're continually looking to improve on what we're doing. So you will receive, if you signed in on the checklist, an email survey that gives you the opportunity to provide feedback on our meeting today. And then there are boxes in there, so please feel free to provide any comments, any suggestions. If there are needs that you have, if there are partners that you want to connect with, please use that as an opportunity to let us know how we can help you. So with that, I'd like to introduce Casey. He's going to give us some information around the exercises.
Okay, well, thanks for coming to the meeting today, everybody. Hopefully we'll have some good information for you about the exercise. We've been sending out a lot of emails and toolkits and everything about the exercise, so hopefully we can clarify some of the aspects about the exercise that have been a point of confusion. Just a quick show of hands. How many people here know about the upcoming exercise? Great. Have you guys come today with questions? No. Okay. All right. Well, that's all right. What I've done is I've put together just a few slides. We're not going to go too in depth. So I'll be able to answer questions on how we're rolling the exercise out at a regional level, and then maybe the more specific questions that we have, we can work on answering in our breakout group. So we'll get to it. Just a little bit of background about the exercise. This came about out of a coalition requirement that we had to do a Healthcare Coalition surge test that involved an evacuation exercise with the hospital. Now, we also know about the CMS requirements and your requirement to perform an exercise. So we thought, is there an opportunity here to help make this exercise mutually beneficial for all our coalition partners? So what we've planned in the exercise is hopefully an exercise that should help you meet your CMS requirements and help us meet our requirements, our contract requirements, and it's just beneficial for everybody. So to that end, there's two separate parts of the exercise. There's a sub-regional aspect of the exercise, and there's a regional aspect. And then, if I can figure out how to use this point there we go. They are connected through our situational awareness process, or EEI/Essential Elements of Information process. So at a sub-regional level, we're very focused on hospital evacuation and placing those patients in the appropriate facilities after they've been evacuated from the hospital. So just to paraphrase some of our objectives for that piece of the exercise, the first objective will be to collect and share situational awareness. That's that situational awareness piece, EEI stuff that connects to the other aspects of the exercise. The next part is to activate the DMCC plan, or the Region 9 Disaster Medical Coordination Center plan, in an effort to coordinate placement of those patients. So you heard Erica, both Ericas today, and Travis and Ed mentioned the DMCC plan and how that's been a lot of work, or quite a lot of work over the last 15 months. So we're trying to put that to the test and exercise it. And then the last objective covers patient transportation. So the second one covers kind of placement and where are these patients going. The next one covers how are we getting them there. And then at the regional level, which probably touches most of our partners and will be beneficial for the majority of them, we're exercising, again, the situational awareness process. And then we've also created some adaptable objectives that will help facilitate sort of internal exercise play for each facility participating. So the second one is assemble and begin emergency response. Your emergency response using an emergency response plan, very basic and adaptable. And then the last one is discuss and identify key decisions related to staff roles and client placement and communications necessary for an effective evacuation. Now, just to reiterate, these exercises, although they seem separated, they are connected in that situational awareness process. So just to go over the flow of each exercise, the sub-regional aspect will start with the first hour doing a internal activation. So that will take, notification will go out to the evacuating hospitals, and they will activate their hospital incident command teams to get together and begin internal action planning. So once they get through that module, they'll work on the patient placement coordination, which includes external coordination with the external partners, which essentially means they're going to speak with the Healthcare Coalition, look at other hospitals, including the DMCC, and that's where the Healthcare Coalition will activate their situational awareness process and send out the essential elements of information tool, which is where everybody else receives. So everybody signed up to participate in the situational awareness process will receive this email from the coalition during the exercise. That will basically ask, what is the status of your facility currently? We've designed it to kick off your exercise. So that essentially is the start of the exercise. So you'll need to activate your response team or your command team in your facility and fill out that situation report or fill out that EEI tool and send it back to the coalition. That covers the community-based aspect of the exercise. The next part, well, is you respond to the situational awareness, and then players assemble and begin to play. So there should be some sort of internal policy that you are testing here. So that policy should be, in an emergency, who are you notifying and who do you need to have involved? Who needs to be at the table for this discussion? So look at that policy and really put that to use. That is a critical piece of the exercise. Then once you're in the room to discuss your response options, you'll discuss your internal evacuation, and then it should end after the exercise will end after 2 hours for these participants. I want to reiterate, this exercise will not count as a community-based exercise if you don't do all 3 of these things. Now, if you want to set up this part and this part differently in your organization, you're more than welcome to do so. But we have created a toolkit to help facilitate this part of the exercise for you. So it's up to you if you want to use that, or if you want to develop something a little bit more facility specific. And then at the end of each exercise, each portion of the exercise, there will be a hot wash and sort of a debrief. I also want to reiterate that we are planning to do this exercise 3 times throughout the year. We started planning this first one in July. We had an initial planning meeting, and we just completed our midterm planning meeting. And then in October, this exercise will happen. We'll have our final planning meeting, and we'll actually do the exercise in the last 2 weeks of October. Some wordage that you might have seen across in the emails about the exercise is that it's a low notice exercise. So that means we can't tell you the exact date of the exercise. We could, but then it wouldn't meet our requirement for fulfilling a low notice exercise. So, but we can tell you the 2-week time frame that it will occur. So the last 2 weeks of October is when the exercise will occur. After the exercise, we'll be drafting after-action reports, but it's up to the organizations participating in this part of the exercise to do their own internal after-action report, which is a document that we provide in the toolkit. So if you fill out that document, you should be able to meet your CMS requirements with that document. Each time we do the exercise, it should be somewhat of a repeat, but also we want to evolve in the exercise and how we administer the exercise. So we'll be reevaluating how we've actually designed the exercise each time in order to better meet everybody's needs the next time we do the exercise. So participants, just a quick review. At the sub-regional level, we have hospitals from the 3 northern counties of Region 9. That includes Berry County Memorial Hospital, Newport Hospital, Mount Carmel Hospital, and St. Joseph. And then Holy Family Hospital will be participating as the MCC. We have Stevens County, Berry County, and Ponderay County Emergency Management involved in that part, Region 9 Healthcare Coalition. We've got Tri-County Public Health involved, and other EMS organizations from around that Tri-County area. For the regional aspect, this is the connector here, the Region 9 Healthcare Coalition. So we'll be a part of that in that situational awareness process, and then there will be a variety of individual healthcare organizations, including long-term care, skilled nursing facilities, other hospitals potentially, and even home health in those organizations. So it's really trying to do a catch-all, trying to meet everybody's needs, but we understand that everybody's situation is unique. So the documents that we send out to help you with the exercise are adaptable. They're Word documents, so you can update them and modify them as you fit. So participants at the sub-regional level, we've already been planning, and we've been conducting planning meetings with those people. But at the regional level, the first step that you should do is sign up for our situational awareness process. And if you have done that, you should be receiving email updates about the exercise, which include the exercise toolkit that is sent out. So if you're not sure that you are signed up for the situational awareness process, or if you've been getting those emails and just they haven't caught your eye, let us know. Email us at htc@srhd.org, and we'll be able to check on that for you. And if you're not involved in that process, we'll be happy to get you involved. Okay. Does anybody have any questions about the exercise, or at least the concept? Okay. Has anybody had any issues looking at the toolkit documentation or opening the documents? Okay. Yep. Okay. 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 So if you do have issues with that stuff, email us. We can send you the documentation directly. Okay. All right. Yeah, Heidi. Right. And we had set up a couple webinars where we just sit in there and we say we're going to be available to answer questions, and those have been helpful for the people involved, I think. And so if that's something people are interested in, just let us know, and we can make that happen again. Okay. And if you have any questions, feel free to email me directly, or go to this email and it'll get to me.